Okay, so I had a prednisone warrior ask me if the information I provide about prednisone only applies to that and not other steroids, or does it apply to other steroids? So, to answer your question, I'm first going to give you a disclaimer that this is not medical advice. You need to talk to your doctor specifically about your specific situation. And then I'm going to apply it generally to the drug itself, and then I'm going to read the question and apply it. Okay. So this is what Prednisone Warrior asked. Is the information provided solely for prednisone, or does it apply to other steroids like asthma inhalers such as fluticasone? I only use prednisone for asthma attacks, usually a 5-day treatment, but had 3 asthma attacks last year and was on prednisone 3 times, and one of them was for approximately 1 month. Although not taking it now, it seems that other steroids cause similar side effects. Thank you for your time. So, to answer this question, generally, other steroids have very similar side effects. The overlap is very dramatic. Whether it's fluticasone, prednisone, methylprednisolone, dexamethasone, hydrocortisone, or whatever, they generally have the same side effects. The real question is, which ones will you get based on your dose and how you're taking it? So if you are getting steroids injected into your body, you're going to get the most side effects because it's going the most places. The next most side effects are caused by the pill itself because you're absorbing it from your gut and then it's going throughout your body through your blood. When you're specifically asking about asthma inhalers, it's limiting where that steroid is exposed to. So an inhaler generally only gets the steroid fluticasone in your respiratory tract. So you breathe it in and it goes in your mouth, down your throat, and into your lungs. And that's usually the only areas exposed to the steroid and having the most side effects. But because it has to go through your mouth and your other tissues do have more absorption, it can go what's called systemic throughout your entire body, but it is just much less rare to have it cause like systemic side effects. So, for example, if a child takes a prednisone pill, that's a systemic dose, and it's more likely to cause what they call growth retardation, or like slowing growth, having the child not grow as tall. As opposed to if they only use an inhaler, they're much less likely to have as much of a growth retardation. Or another thing that people might have is osteoporosis. It's a common side effect to any steroid. The bone loss is most common. The higher the dose, the longer the dose, and the more area exposed. But if it's an inhaler, it's not impossible to get osteoporosis. It's just much less common. So the higher the dose, the more of your body exposed for the longer amount of time, the worse the side effects. But as far as does this apply to other steroids? Yes, it applies to basically all the other steroids. There are a few, like the overlap is probably like 95%, where there's like 5% difference between all of the different steroids that's unique to them. But for the most part, everything I say about prednisone can be applied to all of the other corticosteroids. Now, that term steroid is also a confusing term because that can be used to describe anabolic steroids that bodybuilders use. And so I want to make sure that we're not applying it to that kind of steroid that somebody's using to build muscle and is mimicking testosterone. That is not the kind of steroid we're talking about. We're talking about the kind of steroid that helps with inflammation and immune system. So, yes, the answer is yes. The information provided applies to other steroids. All right. If you have any other questions, feel free to comment below and we'll see if I can answer those as well.